Welcome to Go to Market, a podcast for RevOps sales and marketing leaders to dive deep into industry insights and best practices. Go to Market is sponsored by Fullcast and Silicon Slopes. It is my absolute pleasure today to welcome Mike Woodruff, Executive Medical Director of Regence, BlueCross, and BlueShield of Utah. How are you doing, Mike?
I'm great. Thanks for having me, Amy.
Oh, thank you so much for jumping on a Friday morning. It looks like it's a good day for you and a beautiful day for me, and it's nice
Ah,
to just be able to chat and have a few minutes to connect about some of the important things that patients are going through on the go-to-market side. So,
yeah, great to
um,
be with you. I really appreciate it. And it's a sunny day in Utah. I'm not sure where you are, but
good.
it's sunny here
I'm in
too.
Southern California,
Ah,
also sunny and beautiful, so that's awesome. So, first of all, to get started, will you just give me a little bit about your background? How did you get to where you are today?
oh my gosh. Well, it hasn't been a straight path at all. I'm an emergency physician by training. I went into medicine to help alleviate suffering. And I think that's been a through line for my whole career, probably, is that everything I've done has been in service of trying to alleviate suffering for people in either their personal health or their ability to navigate the healthcare system or their ability to work in the healthcare system because there's so many opportunities for friction and for things to go awry in the US healthcare system. So that's really motivated me throughout. So I I worked as an emergency physician for about 20 years, and most of that was at Intermountain Healthcare and here in Utah, and I led quality and patient safety for a number of years for Intermountain, and I really was interested in improving how we do things. And in
Mhm.
particular, how do we improve things so that we're not harming people with our treatments or with the way our systems organized. And then recently, about 2.5 years ago, I joined Blue Cross Blue Shield as the executive medical director for Utah. And there I get to work on affordability, how we navigate the system, and really how we interact with physicians and our members. And the reason that I thought that Blue Cross Blue Shield would be such a great fit was that our mission is really similar to the mission that I've been working on my whole life, which is to make healthcare simpler and more economically sustainable. So that's something I can really get behind, and it's something I'm privileged to be able to do in my work.
Well, I love that. And the alleviating suffering really resonates with me as well. I have been a healthcare marketer for about 20 years. Before I got into tech, I was in healthcare and especially in skilled nursing. And so there's a lot of opportunity to see improvement there and also see some of the great heroic acts that people are doing to try to alleviate that suffering. For me, my dad, he passed last year, but when he was in his early 40s, he was diagnosed with a malignant form of brain cancer and
Mm.
almost died. And so that really affected my brothers and sisters and me. I have a brother who is now a pathologist and another brother who is an endodontist and a sister who's a nurse. And so we are all very grateful for the physicians in our lives who have alleviated suffering. So
Mm.
it holds a special place in my heart as well. And today we're going to talk about how to help people make it easier to afford healthcare and some of the ways that patients can really use companies like Blue Cross Blue Shield and understand the options available to them so we can make it more affordable and a better system to alleviate suffering. So, one of the things that I found so fascinating about your background when we talked before was your emphasis on connection. You connect the physicians, you connect the patients, you connect the patients, like the patient safety people, the QA people. And then on some level, I'm assuming that you also work with all of the data ops and the back office people. Can you describe to me a little bit about like how does the system work?
Oof. It's such a complicated system.
Let me
Yeah.
just drop that bomb on you right now and be like, "Tell me, how does this thing work?"
Or better question, how does the system not work, right?
Yeah.
I think the where I start is the healthcare system was not designed by anybody. It was not designed to work as a system. It evolved over time. And there are many competing stakeholders, competing incentives, competing parts of the system. And in the middle of all of that are the patient and the physician. And
Mhm.
unfortunately, sometimes those kind of mixed incentives interfere with a person's ability to navigate the system, to get care quickly, to get the right care, to get the right outcomes. And this is what's leading the US to be one of the bottom performing countries in the world in terms of our health outcomes. And we really should be the top, right? And for me, it's because of the way the healthcare system's designed or not designed to work well together. So I'm fortunate in my work to be able to see behind the curtain. I spent much of my career as a physician thinking, oh, money will come from somewhere to pay for this treatment. And my eyes have been opened. I think a lot of people have the impression that health insurance is about denying care and it's about limiting access to care, when in
Mhm.
fact, really couldn't be farther from the truth. What I think most health insurance companies are going for, especially not for profit tax paying health insurance companies like the one I work for, is the right care at the right price
Mhm.
at the right
Mhm.
time for our members. And believe me, it's often hard to get to that. And I think we have a long ways to go in terms of how to make that really easy to
Mhm.
do. But I think understanding that 65% of people in Utah and about a little over 60% of people in the country, their healthcare is sponsored by an employer, their healthcare
Mhm.
coverage. And the employer pays the lion's share of the premiums and the cost of
Mhm.
that care. And that means the money doesn't come from anywhere, nowhere. It comes from employers and
Mhm.
the rest comes from taxpayers through Medicare
Mhm.
and Medicaid, right? And then a little bit comes from the people who are getting care and their copays and things like out of pocket maximums, things like
Mhm.
that.
I think that what you're doing at Blue Cross Blue Shield is so wonderful. Like, you guys are really focused on the patients. You're really focused on how do we provide amazing quality of care, and how do we increase the accessibility, and how do we increase the affordability. Like you said, there are so many people out there who have a misconception about insurances, just like you stated. And I think that when you really dive into it, and when we were talking last time, that was my main takeaway. My main takeaway is insurance companies like Blue Cross Blue Shield are here to help us, and they're trying to solve these challenges just as much as or more than other people are trying to solve these challenges. So I find it really I'm very excited about that future and about people like you who are in places where innovation can take place. And so when we're thinking about, ultimately this is a go to market B2B podcast. When we're thinking about being healthcare innovators, from your perspective, what should we be looking to do? And what are some guardrails, like some do's or don'ts that would be really helpful for the healthcare community or not helpful?
Mm. Wow. Well, I think it never serves us wrong to think about the patient, or in the case of, the insurance company, we think about our members who are also patients. So that's number one. Like what do patients need? And again, it's access, it's being able to afford healthcare, it's
Mhm.
access to healthy food and staying well,
Mhm.
which is
Okay.
a really important thing. The healthcare system is primarily designed to treat illness and disease. It's
Mhm.
not designed to keep us healthy. And so I think innovating around, and we're starting to see a lot of this,
Mhm.
you know, innovating around things like diet and exercise and changing
Preventative.
lifestyle, preventative care, all these things that actually mean ultimately you're going to stay healthier, you're going to need less acute
Mhm.
care in the healthcare system, and you're going to have a better life, frankly. And
Mhm.
oh, by the way, it's less expensive at the same time.
Yeah. Oh, that's
I want to see more innovation there.
okay. So preventative care is a really good area to go into. I've heard a lot more about personalized care. Can you tell me a little bit more about your take on that?
Yeah, I think we just did a debate about this at Silicon Slopes recently. It's a really great question. We are entering an era where actually we're already in an era where personalized care can be really meaningful and much more effective than kind of average population care. And I think the balance there is around the proof that we're going to get the outcome that we want. And it's hard to prove sometimes on an individual level that a treatment is going to have the desired outcome.
Mhm.
It's easier to say using scientific methods that for like on average, this is what the outcome is for large populations of people. I think we're seeing more and more therapies that are actually based on who we are genetically and physiologically
Mhm.
that are going to have more impact. And I think as we develop that, we're
Mm.
going to have to think, you know, part of the reason that insurance companies have to say no to certain treatments is because there's many more treatments than there are treatments that are proven to work, right?
I
And everybody wants everything. I'll put it out there. Like,
That's so true. Well, when you have your loved one that
yeah,
you're really worried about, you're like, do anything it takes,
yes,
right? And
right.
it might not be the most rational, logical, or even helpful decision.
100%. And we all think that way. And
Mm.
that's really the tension that's
Mm.
inherent in healthcare as a business versus healthcare as an art versus healthcare that you experience as like, I'm a person with a sick family
Mhm.
member, right?
Mhm.
And there's a lot of tension in that. And there's a lot of expectations that are hard to meet in that
Mhm.
tension. But and I think the only way through that is for us to work together, to collaborate, and to acknowledge these hard truths about healthcare. We're not getting the outcomes we want. It is too expensive. People want a lot of things. And how do we start to say, like, okay, we think this treatment is going to have the best chance for you, and
Mhm.
taking all those things into consideration, not just the newest and fanciest, right?
Mm.
The
Mhm.
one that we think is going to work for you and not drive up the overall cost of care at the same time. So it's a super hard question. I wish I had a
It
great
is.
answer for you,
No,
but
I mean, it is
I'm
so helpful. It's like for me as an entrepreneur, it is so helpful for me to get in like the opportunity to talk with you about your thoughts and your perspective on the healthcare system and where you think innovation is the most meaningful. There could not be a better interview for any entrepreneur listening to this in the healthcare space, right? Like this is incredible information. Like, so I what we're understanding is like if we're going to build something as an innovator that's going to be the most helpful for healthcare, it's got to be around making healthcare more accessible, making it more affordable, or improving patient care, right?
yeah,
Those are the
yeah.
3. Those are the
Yeah.
3 pillars, right? That you just said. And then you've mentioned like personalized care might be a good area for innovation. And you mentioned, I just forgot the other one that you just said. The
Well, wellness and preventive
well,
care.
yeah, wellness and preventative care. That's right. Would be another really great area for that. I've seen some really interesting innovations lately. I just had Savos Health on a couple of weeks ago, and they were talking about the escrow system that they've built to help shorten that gap between the patients and the physicians.
Mm.
And so I thought that was a very interesting innovation that was super helpful for the healthcare
Tell me
system.
more about that.
So I got to get Jake back on here to talk with all of us. But what Jake basically did was he is helping patients negotiate an out of pocket care, but and also paying the physicians day one, and
Mm,
he makes sure that that transaction takes place at the time of service, so the physicians get their payments right in time, and then the patients are able to pay a discounted price. So
mhm.
I was like, there's a good example of some good innovation, right?
Yeah, and the system in terms of payment and rate negotiation, it's ripe for disruption, right? I mean, we've been doing similar things for years and taking a very adversarial approach sometimes, which is frankly not productive. So I think if there are innovators out there who are going to solve the problems of how we get people paid appropriately, but also have some risk for the outcomes, be on the hook a little bit for the outcomes for the care that you're providing. Like that's been the promise of value-based care for decades, and I don't
That's
think
right.
we've fully achieved that. You know, at
Yeah,
Regence, we have I think about 50% of our claims flow through value-based arrangements, but that's only 50%.
right.
And we want to get higher, and there are a lot of barriers to that. I don't want to go into all those, but I'm just saying, like, the system's ripe for this disruption
Where
there.
it is,
For sure.
and also understanding the heart of the matter, right? So, like, coming from skilled nursing, we understood value-based care is essentially the hospital is going to distribute to the lowest possible denominator. So the SNFs were like, "Oh, why is home health getting part of this value-based care? We need it." But,
Right.
this doesn't always rise to the level of needing a SNF, right? And so I think being able to kind of like take an approach where we're like, what is actually the best for the patient here? And all leveling ourselves up one and getting out of the, having those value pillars that you mentioned so well, and really trying to get out of the place where we're trying to make the most money that we possibly can. And sometimes that's hard as an entrepreneur because you're in a startup and you're funding innovation and you got to have the money coming through. And so but I think it's a really good reminder, that it's gotta be focused on the patient.
Yeah, I guess, don't get me wrong. I mean, people have to make money, and reward fuels innovation, and that's important. But I guess what I'm arguing for is keep an eye on the big project of what we're working on.
Mhm,
We're not just building part of a rocket. We're trying to get to the moon. We're trying to get to Mars, right? We're trying to get out there and do big things. And that requires a level of kind of coordination and working together and not considering just our own siloed widget. The world, the US, the healthcare system does not need more expensive widgets, right?
mhm,
We need solutions to big systemic problems. And I think that's where I want to see all these really, really powerful and creative minds working.
mhm.
I'd
Yeah,
say the
no.
other thing, Amy, that excites me
Mhm,
is, and it's the elephant in the room, right? AI. Everyone's talking about AI. Don't
mhm.
just develop something because you can in AI, right?
Yeah,
How do
right.
we use AI to make drug development faster and cheaper, right?
Mhm. Yeah.
Device development, prototyping, can it be less expensive so that the
Mhm.
price can come down? The
Yes.
R&D costs are fewer. We can actually do the research maybe in a virtual environment
Mm,
sometimes. That's starting to come through. But keeping that in mind, like, what's the end goal, right?
I love that. Don't
Affordability,
you know
access, better outcomes.
That's right. It's not just innovation for innovation's sake. And right now, as we're just starting to harness the AI possibilities that we have, so much of it right now, because I'm an AI company, right? Like we have developers working on how to improve our sales process as our company
Yeah.
throughout using AI. But right now, we're kind of in the exploratory stage. A lot of us are like, "Whoa, look what this thing can do," you know? And then we hear about the rogue agent that gets out and unprompted posts on somebody's social media channel. "Look what I did. I got out of a security hack." And so then it makes everyone nervous, right? And so that's a really good example of how we can, be very ethical and forward thinking about our use of AI and do it according to those 3 value pillars. Like, if it's not going to improve access, if it's not going to improve affordability, and if it's not going to improve patient care, then I don't really need to do it, you know? And so I think that that's really a fabulous comment. Do you have any final words of wisdom for innovators who would like to work with Blue Cross Blue Shield one day, with people in the healthcare entrepreneurial space that would like to grow in this very complex and complicated environment?
Oh my gosh. I mean, I would final words of wisdom. Well, first of all, I love that you brought up the concept of an ethical approach. And I think I read a quote recently. I can't remember it word for word, but it was about how integrity is one of the things that makes us uniquely human.
Mhm.
And I think having integrity in your process is never going to serve you poorly. And I'm when I say integrity, I mean keeping your eye on who you're trying to serve and making sure that all your actions are pointed towards that service. And
Absolutely.
I'd say that in healthcare, there are some great groups working on innovation. BioHive Utah comes to mind that
I
I
love
just
Andy. Just
yeah.
talked to him yesterday. He's amazing.
Yeah. Yeah. And at the University of Utah, the Center for Medical Innovation is an amazing resource. They're doing great work getting young entrepreneurs, young inventors, young healthcare professionals to work together in a way that's really meaningful to create things that are going to change lives and change the healthcare system. So I'd say that there's just so many good ways to get involved. Don't do it on an island. Don't just look at your own finances. Think about, what's the community around you? What are the resources? Who else is working on cool stuff that you can partner with? And then importantly, who's not in the conversation, right? Bring in a doctor, bring in a nurse, bring in a patient and have them co-design with you. And your product will be stronger for it.
That is excellent advice. When I was the CMO of Pathology Watch, which was a
Mm.
health tech company before, and one of the founders was a physician, and she was absolutely instrumental in making sure that those ethical boundaries were never crossed, that we were serving the right people, and that we had a solution that really worked to support patients. So I love that comment as well. Well, Mike, thank you so much for coming. It has been such a valuable experience for me to chat with you as an entrepreneur. And I know that everyone else is feeling the same way that's listening to this. So I really, really appreciate your time.
Thank you, Amy. It's always a pleasure and quite an honor to be able to sit with you and have this conversation.
Likewise. Thank you.